Welcome to the Neuroblastoma Parent Global Symposium. My name is Leona Knox from Solving Kids Cancer, and I am also the parent of a childhood neuroblastoma. I will be moderating this session, Seeking a Second Opinion and REDMAPP Study, which is being delivered by Dr. Ramanujachar, Pediatric Oncology Consultant from University Hospital Southampton, and Helen Pearson, Advanced Nurse Practitioner, Solid Tumours from the Royal Marsden NHS Foundation Trust and University Hospital Southampton. Before I hand over, I'd like to draw your attention to the Q&A button at the bottom of the screen to submit questions during the session for the speakers to address at the end. If the button is not showing, just tap or hover your cursor to bring it up. If you see a question there that you like, give it a thumbs up to move it up the list. Over to you, Dr. Ramanujachar.
Thank you for the kind introduction. And a very good morning to you all. It's a real pleasure to be here with you on such a large global symposium. And I would like to thank the SKC for giving me this opportunity to share our UK experience. I have no conflict of interest to declare. What I also have is a list of questions for you all that I'm going to bring up right at the end, which is going to basically explore some of the aspects about your awareness of resources that are available, as well as what your experience has been so far. How would you really like this to evolve? Because we just want to be here to support you. When a child is diagnosed with neuroblastoma, it is a difficult journey. It only gets more darker when your child is not responding to treatment that you would like to. At that point, you are always at crossroads. What do I do? Where do I go? Whom do I trust? And we, as the community of pediatric oncologists with special interest in neuroblastoma, would like to be a part of that journey. Not because we feel it is necessary, but also we feel it is our duty to be there to make sure that your child not only gets the best treatment, but also the quality treatment that your child deserves. And that is where I would like to today show you a little bit about our work and also how you can actually seek second opinions. And what I hope you will get from this whole talk is how you can get a second opinion without actually feeling shy, and what resources are available within the UK in this context where sometimes there is actually no evidence from papers or clinical trials. And how do we make sure the best care can be given to your child? And lastly, how and where and in what situation the National Neuroblastoma Advisory Panel helps and can help you all. My talk is going to be predominantly on the National Neuroblastoma Advisory Panel that I co-chair, and also I coordinate with a number of other professionals. And what I'm going to do is briefly describe what the aims are, but also the process of how you can actually approach and what you can do, and some of the outcomes that we can talk about. And lastly, how we can actually move this forward with your help. So the National Neuroblastoma Advisory Panel is something that we initiated nearly 3.5 years ago in May 2017. And I chair and coordinate this, and I'm really privileged that I have a whole panel of experts in the various multidisciplinary aspects of the specialist care that is required for neuroblastoma. Within this panel of 14 members, we have clinical oncologists, that is the radiotherapists. Then we have pediatric oncologists. We have radiologists. We also have surgeons, specialists who are interested in immunotherapy and can advise us about it, and specialists who have access and can advise about new agents and targeted therapy that is available not only nationally, but also internationally. Obviously, nothing of this is possible without understanding the tumor and the tumor biology. So we have a molecular biologist. And obviously, we would like to disseminate this information. So we have and encourage other pediatric oncologists, surgeons, nurses, and clinical fellows who sometimes join this advisory panel. And what is the aim of this panel? It is to mainly support you and your local clinician. We would really like to be able for you with your local clinician to make the shared decision making when things are not easy and you're at the dark end. But ultimately, our secondary, but the main aim is to improve outcomes, be it the care, cure, or even disease stability. So what is the process? We have a referral form that is available on the CCLG website. In fact, I just updated it last year this time, that your clinician is requested to fill with all the clinical details, including the treatment, the response, and also what I have included since I did this talk last year is I've added in a few boxes to ask them, have you discussed, meaning has the clinician discussed this with the family, that it's going to be discussed in the NNAP? Are there any specific questions from the family that we should be addressing? So these have been added on to the referral form. And once those details have been filled in, they are sent to me, and the images are sent to our panel radiologist. And it is your clinician who ultimately is going to present this in the meeting so that we get to know as much information as possible. Just for you all to be aware, there is governance structure so that the confidentiality is maintained all along. So we do not get to know all the patient identifier details, but it's just the relevant clinical details. So we do make sure that confidentiality is maintained all along. And finally, I do a summary, and that is sent back to your clinician. So in other words, you can be involved right from the word go, requesting and putting in what your specific requests are, engaging in the process, and making sure you actually get a summary if you feel you need it. And this is a meeting that has been hosted by the Children's Cancer and Leukemia Group, and I have to thank them because now, following from this Neuroblastoma Advisory Panel, we have tumor panels occurring across most of the tumor sets. And it is a virtual meeting, just like the Zoom meeting. It occurs on a monthly basis, and it is every second Friday of the month. And although we are supposed to be discussing it for an hour and a half, and it's completely a voluntary basis, that all of the specialists on the panel give up that time on a Friday to be in that panel meeting because we strongly feel we ought to give this back to the families. And the limitations are we can advise, and we are not MDT giving recommendations, but equally we feel that we can give something that is more holistic and appropriate. But obviously, given the time limits, we are able to discuss only about 4 or 5 cases. And hence, we have to look at other alternatives of how we can take care of the other clinicians who sometimes can't be able to present. So we do have email communications, but I bring it back to the panel. So very briefly, looking at what we have done and how we have done so far in terms of what kinds of patients we've discussed so far, how are the centers referring, and also some of the examples to take you through. So to date, starting off from May 2017, which is nearly 3.5 years ago, we have had a total of 146 referrals. And some of the patients obviously have been discussed more than once, but taking you through this bar graph, which starts off from May 2017, the first year, and coming to the latest, which is now, on an average, we are seeing roughly about 40 patients per year and being discussed. But as you can see this year, just in 6 months, we've already had 28 referrals. So if you can calculate the same amount, we are going to be probably looking at many more patients being discussed this year based on the needs and also based on, I think, the information that has got around that this panel actually exists. So thank you all if you have been engaging in this process. And as some of you will know, the pediatric oncology services in the UK is around 21 CCLG, tertiary pediatric oncology centers. And what I have here on this graph, as you can see, is on the map of the UK, the various centers that have referred to us, including the numbers of the patients that they have referred so far. These are the numbers. Sometimes some of them could be more than once. And as you can see, every center has taken part in this, including Scotland, Ireland, as well as Wales. And in addition, we've also had some of the adult centers recently, such as the Guy's and King Thomas's Hospital, who have also referred to us. So on an average, we discuss about 3.5 per month is what I have calculated from these numbers. It is quite interesting, and we would automatically think that it's the refractory or the relapse patients that we're discussing the most. But actually, we do have a wide variety of referrals that come through. Obviously, the high-risk neuroblastoma are the predominant ones, and within them, it is the primary refractory and progressive disease, about 38% of them that we've had to date. And the relapse and multiple relapse patients and how do you really manage them are the most difficult ones. We also get an equal number of low and intermediate risk group patients. In other words, it's almost, you can say, a third divide between all of these patients. So in other words, no single type is not something you should be asking for. You could be having your child with a high risk. Equally, you can have your child with an intermediate risk, but having loads of problems, simple example being surgery. So we've had an extensive age group of patients being referred to us, including infants as well as adults. And in fact, this year we had a 51-year-old adult being referred to us, which I'm going to just speak about a little later. And to date, we've had about 8 adult patients being referred to this panel. And this is something we are also learning because I don't think we also understand how adults have to be treated, because we think the biology of the adults is very different from children. And certainly the adults do not have any knowledge about how to manage this pediatric tumor. And we have queries not only from chemotherapy, targeted therapy, local therapy such as radiotherapy, but also we have specific surgical questions at times, which is actually a third of our questions. So that gives you a flavor of the type of patients and the referrals we get and how we are able to advise. So just to run through a couple of examples to give you how we can make difference or not. So as I mentioned, recently we had a 51-year-old adult being referred to us with high-risk neuroblastoma. And we were able to advise about how the staging process has to take place, where the surgery can be done, how they can access all the molecular work, and also how they can access treatment and giving them the protocols, which really help not only the family, but also the clinician who is an adult oncologist. And secondly, we've also had now parents directly contacting some of our panel members to say, actually, my local team says surgery is not feasible. What do you all think? And we were able to support the family, and the information and the advice was they concur with the local team that surgery actually was going to be difficult because of surgical risk factors. So in that way, the family felt reassured that the decision such as difficult surgery is always difficult, and they have explored the best of the surgical expertise in the country. So where are we trying to go next? Obviously, we think we are making a good impact. In fact, the very short survey that I did with the panel members, everybody felt that we are able to support and advise the local clinicians. And however, that's not it all. We want you as families also to tell us, have you used this? What are your feelings about it? How can we make it better? And in fact, the next talk, the REDMAPP study that Helen Pearson is going to be talking about, is part of what this is. Also, we have currently a project that is being run by the Children's Cancer and Leukemia Group, the CCLG, where it is an assessment of all of these advisory panels to see how it is being run, also how it is impacting just the clinicians, but also how we can impact the families, so that ultimately we would like this to be high up on the agenda of the NHS England to make sure this is commissioned and also to make sure that is regulated and it's actually something that has to be compulsory for everybody. So please share and tell us how we can move forward. But it's not just the NNAP that is going to give you all of this advice. There are a number of other resources that are available for professionals, and some of them even for y'all. Simple example, nationally as well as in the international level. I also chair the Neuroblastoma Special Interest Group nationally, and we have made sure that we put down the latest guidelines if there's no clinical trials available, as well as information. And we also run educational meetings as well as clinical trial update meetings. In fact, earlier this week on Tuesday, we had a virtual national meeting with over 80 clinicians and professionals attending it. So these are regular meetings that are taking place so that we can keep everybody informed of what is happening, what is the latest, and what are the challenges. And we're all part of the collaboration of, that is in the UK, the COPN, which is the European Research Network for Neuroblastoma, so that we all work collaboratively so that the information as well as the advice that we give y'all is something that is not just within the UK, but available across. And you should also remember that the ECMC, that is the European Committee for Medicine's Consortium, also has a regional relapse NDT, which is divided into 4 different areas within the country that does weekly meetings that also goes through what the tumor type is, what the biology is at the time of relapse, and therefore, is there any targeted treatment available that again, your local clinician can get on to. And we also have the Innovative Therapeutics Committee, which can feed into not only the NNAP, but also your ECMC meeting. And don't forget, charities, particularly the Solving Kids Cancer, has also got a lot of information, a lot of people with expertise, how you can access information, whom do you go to? In other words, there is a lot out there that you don't have to feel lost. At the local level, the Principal Treatment Center, that is your oncology center, also has diagnostic and treatment MDTs. In addition, they also have access to clinical trials and recruitment, and when not, the clinical trial guidelines. And this is just an example of what we have put on the CCLG website about what the latest is in terms of information for treatment and guidelines. And this is updated on a regular basis. So what I hope I have told you all from this very short session, but I'm very happy to take questions in the end, are when you're trying to seek a second opinion, please do not feel alone or shy. Speak to your oncologist and request them if you feel it's necessary, and ask them to access the various portals, including the NNAP and the ECMC Regional Relapse Meeting. And if you feel you're not being heard, please try. If not, the panel members are very happy to be contacted, but we would rather like you come through the local team because then we have all the right information to make the right decisions. There are a number of resources that are available for clinicians and some which are open even for y'all, including our CCLG website. We have, as I said, a number of panel meetings that can address these difficult situations. We are aiming also in terms of delivery of the best care, how we can improve the learning and education for the clinicians. And ultimately, it is collaborative working, and not every clinician can be in every panel. And therefore, this kind of working together is helping. And lastly, the NNAP is an advisory role, and we hope we can help you with the shared decision making. And you have to remember, we do put your kids first, and we do care to make sure that you do have us joining you in this journey. So I would like to thank a lot of people, including the SKC, the CCLG, all my colleagues who are part of the NNAP panel, all of your clinicians, including the pediatric oncologists, and of course, nothing of this is going to be possible without you all. And lastly, these are my questions, which I'd be quite keen to have your answers, and if not, at least if you email to me. With that, I would like to say thank you, and I will hand over the screen to Helen Pearson, and we will come back to the Q&A in the end. Thank you.
Thanks, Ramya. Okay, firstly, a huge thank you to Solving Kids Cancer for allowing me to be involved in presenting the REDMAPP study that is currently open within the UK. So this is looking at developing a decision aid for parents with children with relapsed neuroblastoma to support them in their decision making. So I'm not alone in my research team. There's obviously myself. There's also Professor Anne-Sophie Darlington, who is a professor in health psychology based at the University of Southampton, and also Professor Faith Gibson, who is a professor of child health and cancer care at the University of Surrey, and also actually now is the chief nurse for research at Great Ormond Street Hospital as well. So what do we know about high-risk neuroblastoma in the relapse setting? We know that approximately 50% of children do relapse, and at relapse there is no standard treatment protocol, but varying treatment options available. This means that parents are presented with these treatment options and often have to make repeated treatment decisions depending on their child's response to treatment. So from my clinical experience is that I know that parents won't have been involved in treatment decision in frontline treatment because there's a protocol for that. And at relapse, parents really want to be involved in making treatment decisions, but they can feel the emotional burden, as one parent said to me, in making these decisions repeatedly. And some parents can regret the decisions which they make. So what are we trying to do with the REDMAPP study? In phase 1, we're trying to understand how parents make repeated treatment decisions and how their decision making may change over time with the more treatment decisions which they make. This understanding will come through interviews with parents who are currently going through treatment, and using that information in phase 2 to be able to develop aid to support parents in their treatment decision making. And we will initially use a test that with parents and healthcare professionals to check the decision aid's usability and accessibility. So the aims really are right now to really understand how parents are making treatment decisions currently for their children, and using that information to inform the decision aid in the hope that this decision aid will be able to help parents in the future. So the inclusion criteria for phase 1 is parents that have recently made a treatment decision for relapse, parents of a child that is under 12 years at the age of relapse, and that's because there's quite a lot of decision-making research that involves children that are above 12 years of age. Parents can be re-interviewed if they make more than one treatment decision whilst phase 1 is open, and both parents can participate. And we're really keen to hear the voices of fathers in particular, because previous research has shown that father voice has been lacking. So how can you get involved? There's 2 ways of being involved. First of all, through your child's treatment centre, if they are participating centre, and I'll talk about that in a minute. So if your child's treatment centre is open, healthcare professionals at your treatment centre will inform you about the study and provide written and verbal information. If you're interested in participating in the study, parents have to sign a form agreeing for their contact details to be shared with me as the researcher. The healthcare professional team then share the contact details with me, and I leave it a couple of days before I give the parent a call to see whether they want to participate and discuss the study further if they've got any questions. And then we organise an interview at a day and time that is convenient for parents. Usually, I appreciate this, so far has been in the evenings at weekends, which is absolutely fine. And there is the option on the consent form that parents can opt to have a summary of the findings from phase 1, and also be informed in user testing of the decision aid once it's been developed. So treatment centres that are currently open are Aberdeen, Cardiff, Great Ormond Street, Manchester, Sheffield and Southampton. Hospitals that are in the process of opening are Bristol, Glasgow and Oxford. Other centres have been approached, but unfortunately with COVID, we're kind of a little bit on the back foot. So because of COVID, we have brought in another way that parents can get involved, and that is through self-referring directly to the study. So if you were interested in being involved and your treatment centre is not a participant identification centre, you can contact me through various ways. We have a research study website. We've also got a Facebook page, Instagram page and a Twitter page. If you're interested, I can then email you the participant information sheet and consent form for you to look over. And in a few days after that, follow up with a phone call or email to again discuss the study and see whether you'd want to participate and organise for the interview to take place. And in phase 2, obviously this is the development of the decision aid, which I won't go into today because we're not quite there yet. Phase 1 should be open for at least another year, obviously very much dependent on numbers because obviously this is a small patient population. Yes, and I think that's all I have to say.
Thank you, Helen. And Dr. Ramya, you two really incredibly clear presentations. Thank you for the work that you're doing to help parents in these most difficult positions. I've been there myself and really value, how things are moving forward for other parents. So thank you for that. We have a couple of questions in already. The first one is, Ramya, for you with the NNAP. Is this consulting service available only for UK, or can other European patients access it? If the latter, is there a cost for this, and can it be accessed by the parents directly if they have the full medical records of their child?
Yeah, I think this is difficult because even last year, I think we were asked this. So in short, it is presently only for the UK patients. The only reason being that in terms of the governance and confidentiality and all that, it is set up for mainly our UK patients and parents. But equally, I think what we also would like to see is the involvement and engagement with the local team. So although I'm saying it's only for UK patients, I think we will start looking at how we can explore it outside, meaning is that something at a European level, people like, for example, within the COPEN can also take it up. And that way, if we set up something like a European kind of a national meeting, I think that would really help all of the parents. So it's a winded answer. The short answer is at the moment, it's only for UK patients, but certainly we are keen to explore to see how this can be made European as well.
Fantastic. What about if there's, I'm putting words in the person's mouth here, but if there's any discrepancy between what the parent feels versus what their oncologist feels, can I ask for my child's case to be discussed by NNAP, even if my doctor doesn't think it's necessary, but I just want to be sure? What should I do?
I think, of course, because we have had one or two instances where I think the families have felt the need to feel reassured. And yes, we would welcome it. But equally, if you can mention it to your local doctor to say that I would like, so please don't feel shy, please feel that you can do that, and they can't refuse. And we haven't really seen any of the oncologists saying they won't engage in the process. So I think it's just the beginning hurdle that you feel it's something that you won't be doing, or you would be doing against what your doctor wants, but don't feel shy.
Brilliant, thank you. When a parent is requesting a second opinion and it goes to the panel of experts, do you speak with international consultants too before making a decision?
In the first instance, we discuss it within the panel, but what I think people may or may not be aware is many of the panel members are already part of international collaborations. In other words, they already have that international expertise. At times, I can think of at least one or two instances where none of us actually knew the right answer, in which case one of the members took it on to speak to somebody else abroad to see what is the best in terms of the management. So we do make sure that as much as we are able to advise of what's being available within the UK, also at a global level, we can say, well, there might be something else at the global level, but this is what we can advise now, we will look into it.
Excellent, thank you. Helen, are there many centres who are yet to support the REDMAPP study? And that was one of my questions actually. Can we do anything more through the CCLG network to get any more centres opened? Anything parents can do on their side?
I think it's really difficult. So all centres were approached when REDMAPP opened at the end of last year. And for various reasons, some didn't want to get involved. And that's partly to do with background kind of setting up of studies. The centres that are still kind of sitting on the fence, and that's partly because of COVID, and they've got a backlog of trying to set up other studies within their trusts, are Newcastle, Birmingham, Nottingham. I think that's the only three that I can think of off the top of my head that were initially engaged with the study and subsequently haven't been able to engage further.
Sure, and I think the great thing is that you have managed to amend the study so the parents can contact you directly, so that's perfect. Just another question from me actually, while we're talking about REDMAPP, you mentioned about needing more fathers to get involved, which is something we all know is true, and that voice really does get lost. What is your call to action here? How can we make that happen? Maybe dads are not hearing the information about this study. What do you think we can do?
I think part of the problem, if it's via treatment centres, obviously at the moment, I'm sure all treatment centres are the same, but because of COVID, we're only allowing one parent in.
Right.
And in all the cases so far of the parents that I have interviewed, it has been the mum that's gone in and therefore subsequently got the information. And on the conversations we have said, you know, dad can be involved as well. Obviously, so at the moment it's sort of quite difficult to get to the dads because obviously there's kind of been a barrier if they both haven't had the information. Well, I hope through social media. I mean, we've got quite a lot of outlets in terms of the Facebook page, Instagram. I mean, I'm not the most savvy, but I'm becoming savvy with this study, in the hope that it does catch the eye of parents and particularly fathers, and they can get involved and can obviously contact direct.
Oh, brilliant. And we've also had a message. If Helen wants to contact me, we have a Mind the Chaps Dad's Facebook group at Click Sargent. I can put a request on that Facebook group.
Wonderful. Thank you very much.
Thank you, Jeanette. Back to you, Ramya. How much of the discussion of the NNAP is relayed back to the parent? Sorry. How much of the discussion the NNAP conducts is relayed back to the parent?
I mean, this is something we also really need to and would like to know. So what we have done in our new performer and also what is part of the CCLG ongoing study is just to understand that. So within the performer that comes back with the minutes, we do ask the local team to relay it back to the family. And we would like to follow it up 3 months later to find out what has happened. Has that happened? Has the treatment been the same? Have they changed? So yes, please. If you all can feedback, that would be very helpful. And if you don't get a feedback, please request, because we do send the minutes back and we do request this to be discussed with the family, because ultimately the decision is between you as well as your local team. And that's why we are called an advisory panel.
Fantastic. And sorry, Ramya, just to clarify, and maybe I missed it, what is the best way to get in contact with you at the NNAP? Is there a direct email address, or how would parents feed that back to you?
Yeah, so I would say the first instance through your local pediatrician.
Okay.
And if necessary, I'm very happy, Leona, for you to take all that information and pass it on to me as well.
Sure.
So even you could be one of the portal of contacts to say, look, parents are requesting.
Happy to. So another question. Due to significant medication-associated side effects, decision-making at relapse will be really difficult. At that point, where do we go to get the best outcome data on available treatments and trials?
Yeah, so I think that's where we also struggle when we hear parents and patients and local teams saying this is a child who has relapsed and multiple relapses. So we would like to have as much toxicity of treatment, clinical evaluation and clinical assessments when we get the performer. Secondly, what we have also started doing within the performer is include some data on what current treatment trials are available, or even, for example, if any recent data is available, so that the local team can then share it with the family. But if the family would also like to do that independently, obviously CCLG website is one, and I would say charities like you all would also have that information. But as far as possible within the NNAP, we are trying to include some recent evidence, particularly in the context of difficult decision makings that then your local pediatrician, local oncologist can share with you.
Thank you.
And I think that also goes back, Leona, to say, do we then ask international experts? Yes. So this would be a time point where sometimes we would say, let's just ask our colleagues across the rest of Europe, US, for example, have they had similar patients? What have they done? And one of the members then take it on themselves to do that and feedback again to the local pediatric oncologist.
And Ramya, you spoke about extending the NNAP across Europe. Hopefully that's the goal. Do you know if there's any network or similar function in the US?
I would like to know. I don't know.
Okay, we will find out.
Yes, please. Because it would be nice to know how they do it, what is working and what is going well, and equally how we can improve. So I would welcome that information as well.
Thank you. Helen, can doctors from centres who aren't even REDMAPP recruiting centres still point parents to you directly?
Yes, they can. Yeah.
Good, thank
If
you.
they know of any, please push them my way and I can contact them. I mean, the study has been presented in various places through, Ramya has already mentioned the CCRG Neuroblastoma Special Interest Group, has been in the CCRG Contact magazine. So I'd like to think that quite a lot of healthcare professionals already know about the study, even if their site isn't a participant identification centre.
Sure. And a question, can you get the feedback directly from NNAP? And I presume that this is direct to parents, so they see exactly what was said, Ramya, I'm presuming.
Yeah, so at this time point, I think with the confidentiality issues as well as the governance issues, we do not actually know who the child is. So in other words, we try to maintain that as much as possible because the link we use is also Zoom and all those things. So in other words, we try to keep the personal identifier details of the patient as little as possible. So as much as we would like to get back to you directly, I would say that don't hesitate to speak to your local pediatrician in the first instance to get this referral made. And don't hesitate to ask them for the minutes so that you actually see what's being said, because we do put it out in detail.
Fantastic, because it was just...
So feel empowered is what I would say.
Oh, that's a great message, Ramya. I was just going to ask, actually, you know, is there a summary provided that oncologists can pass to parents? But asking for the minutes sounds amazing. So we have all our questions from the list already answered. And I know, Ramya, you had some questions that would really help with your work in developing this and improving this. Maybe we could look at some of those.
Okay, I will share my screen again, please.
And if anyone has any more questions, please don't hesitate to send them in. We still have a few more minutes.
Yeah, so these were my questions in terms of how much and who is aware about it and aware about other resources. And I think some of you all have already said, but also it would be nice to know what has your experience been so far in terms of using the NNAP, NAP, or other resources, easy, difficult, not possible. And how would you like to see this move forward? And I think we touched upon that briefly at the European level, as well as can we share similar information with people from US? I would like to know as well, I don't know. And lastly, how can we actually continue to support you so you don't have to go too far?
Can I just ask the question you mentioned about having this adopted by NHS England? And I noticed from your presentation all the time that's dedicated to this is voluntary, and I know you've done an enormous amount of work outside of your major role as a paediatric oncologist. What would that mean, the NHS England adoption, and what are the stages to get to that?
At the moment, we are trying to gather information about impact, as well as what it means in terms of the dedication of time for the individual, you can say, specialists. So putting the two together, what we would like to propose to NHS England is, this is what we are trying to achieve, and this is how it has impacted upon the families and impacted upon the clinicians in a good way. And so therefore, can they support us in terms of, say, a portal so that we can make things a bit more streamlined, like I said, confidentiality, governance, and those things. So that would be one thing I would like to see. And secondly, the support that then makes it that the parents don't have to feel that they are going to shy away from asking, but it almost becomes that they can actually feel empowered as well as strong enough to say, look, we would like this to be discussed. So it automatically happens as a process and the whole thing is formalized. And obviously the support then comes with the financial side in terms of, then we can say, okay, we are willing to take on and make it a more European level in a more structured way.
That sounds brilliant. Helen, with the REDMAPP study, I mean, it's just such an amazing story of parents now who are in really difficult circumstances, helping future parents, which is something I think that we all feel really passionate about doing because we've been through that ourselves. So in terms of recruitment to your study and parents sharing the word, and making sure that you get to the point that you need to be at so that the app can be developed, the decision aid can be developed. What more do you need from us as a parent community?
I think word of mouth is really, really important, especially if you've already participated in the study. You know, some parents have said that's been quite beneficial for them, just being able to speak about their decision-making experiences. I think, you know, one thing that I'm really acutely aware of is that obviously this is a small parent population, and in order for the decision aids to be meaningful and represent lots of different experiences of decision-making, the more parents we can get involved, mums and dads, the better. So although obviously there's treatment centres that are open and they are identifying parents as they come through, obviously having that word of mouth within the parent community and sharing on social media is absolutely paramount now, particularly as it doesn't look like with COVID that we're going to get all of the centres open, which would have been the ideal. So parents self-referring to the study is now even more important than it would have been pre-COVID, I think.
And just for clarity, it is only parents from the UK and Republic of Ireland that can self-refer, is that correct?
That's correct, yes.
Okay, thank you. So we have no additional questions. Honestly, I think it's been such a brilliant session, really, really helpful. And it's so helpful for parents to know what goes on behind the scenes as well. Often we face conversations with our child's oncologist by ourselves, unaware of the enormous amount of work that goes on behind the scenes for those conversations to happen. Sorry, one last question. Dr. Ramya, is there room for a more patient family-centered approach to providing advisory services?
Yeah, that would be great, actually. And yeah, I'd like to see how that can be done, if people can come up with ideas.
You're very open about the fact that you welcome feedback, so hopefully that will come
up with suggestions, please, and we are happy to evolve.
Excellent.
And involve.
Thank you both again, Ramya and Helen, the incredible work that you do to help parents. I'm just in awe of you both. And thank you to everyone watching and for all your questions. We've reached the end of this session, but up next after the break, we have molecular radiotherapy for neuroblastoma and transitioning to adulthood running concurrently. Remember, if you miss a session, it will be available to watch shortly after the live session ends on the on-demand page on the event website. Thanks, everyone.
Thank you.
Thank you.